Hello and welcome to Basic Spanish for OT, PT, and SLP clinicians. My name is Juanita and I will be your host. I am an occupational therapy assistant as well as the author of this book, Basic Spanish for OT, PT, and SLP clinicians in the acute hospital setting. This book, as well as the ebook, can be purchased on Amazon.com. On this channel, we are actually working through the book. So if you don't have a copy of the book, I encourage you to get one. You can still follow along, and I think it still will be helpful, but it's much more helpful if you have a visual to look at. Okay, so that being said, I will also put a link in the channel, so that you can have access to the book. Okay, let's start on page 80. Today's session, we're working on page 80. And the top of page 80 is actually the ending of page 79. So we'll go back to page 79 where we're talking to the patient about clearing their throat. So this, remember, it's not just for OTs, it's for OT, PT, and speech clinicians. So many times a speech therapist may want to ask their patient, just clear your throat. So to say that, despeje la garganta. Despeje I got tongue-tied. Despeje la garganta. Despeje la garganta. Despeje la garganta. Close your eyes. We want to see if a patient will follow commands. You want to see if they will, especially our low-functioning patients, sometimes you want to be able to say, close your eyes on command, and if they'll open their eyes on command. So to close your eyes, it's cierra los ojos. Cierra los ojos. Cierra los ojos. The next one is to close your hand. Close your hand. Okay? So, cierra la mano. Cierra la mano. Cierra la mano. Okay? Now remember, if you wanted them to do both hands, remember what I told you, that la, when you make it plural, is las. So, cierra las manos. Cierras las manos. Cierra las manos. So you're telling the person to close both of their hands. While we're here, remember what I told you in the previous videos, that there are some words that end in O, but they don't follow the rule. Remember, we said before that a lot of the words ending in O are considered masculine, so that they would have a definite article of el, but it's not el mano, it's la mano. So this is one of those exceptions to the rules. So you will learn that as you practice, and I can honestly say, now, if someone was to say el mano, it would it just doesn't sound right. It doesn't sound right. So it's something that you'll have to learn as you go. Okay? The next one is close your mouth. Cierra la boca. Cierra la boca. Cierra la boca. Okay? That is not the same as telling someone to shut up. So don't worry. And remember, I've said before, tone means so much. Your nonverbal cues. We spent a lot of time in school talking about verbal and nonverbal cues. So the same way that I could say, good morning, or I could say, good morning. It's the same words, but they don't have the same connotation. So when you speak, if you speak with a polite tone, and we generally should know what polite is, then it wouldn't come across in what we call a nasty way. It wouldn't come across nasty, okay? So, cierra la boca. Comb your hair. This occupational therapists are using all of the time, because we want to be able to assess what a patient is able to do functionally with their ADLs. So, piénase el cabello. Piénase el cabello. Piénase el cabello. Okay? The next one, I go back to my speech therapist here, as well as PT or OT, so you can say this as well. When we want a person to cough, especially maybe a person who is in ICU or the progressive unit, and you may have to do suctioning. And one of the last parts of the suction process is you're pulling out the suction. You want the patient to cough. So you want to say tose, tose, tose. So you're telling them, you're giving them the command to cough. The next one is cover your mouth. Cover your mouth. It's very important nowadays with everything that's going on. We want patients to have their mouth covered. So, especially if they're coughing, sometimes you want to say cover your mouth. So, cúbrase la boca. Cúbrase la boca. Cúbrase la boca. So you're telling them to cover their mouth. Okay? And the last one, again, this is for therapy clinicians. So if you happen to be on here because you just want to watch Spanish, you may say, when will I ever have someone dangle their arm? Which is the next one, dangle the arm. But in therapy, sometimes we actually want a patient just to dangle their arm. So it's cuelga el brazo. Cuelga el brazo. Cuelga el brazo. Okay? So that's it. Remember, I'm trying to keep the videos under 10 minutes. This gives you an opportunity to go back and watch the videos over again and then practice. And I would suggest once you have this down pat, as we say in English, once you have this down, then move on to the next video. And if you have to watch the videos several times over and over again until you get it, that's okay. The same thing we tell our patients. It's okay if you do it over. Practice makes permanent. So that's it for today. Welcome back to those who have come back. I thank you. Gracias por venir. Adiós.